Carey, and I'll be giving a speech on juvenile diabetes. And these are my beautiful audience. First of all, I'd like to thank my audience for being here and dealing with my messiness. So, here we are. One of the most common diseases in America is juvenile diabetes, diabetes. However, many people are not aware of the detrimental effects it may have on its victims. Diabetes is a disease in which the body possesses high blood glucose levels and has a defect in the production or activity in insulin. According to the American Diabetes Association, with over 25.8 million cases of diabetes in both children and adults in the year 2011, this disease is a growing epidemic, increasing from 1.5 million cases in the 1950s to 18.8 million cases in 2010. The three types of diabetes is type 1, or juvenile diabetes, or insulin-dependent diabetes mellitus. The second is type 2, and the third is just gestational diabetes in pregnant women. Here I will talk about juvenile diabetes, which takes a toll on both emotional and physical features in children and adolescents because they are insulin dependent for life, have really strict diets at an early age, and may develop psychological issues. Type 1 diabetes or juvenile diabetes occur when the pancreas ceases all insulin production, leading to unstable high levels of blood glucose, also known as hyperglycemia. Reactions to hyperglycemia are frequent shaking, irritability, confusion, and may lead to unconsciousness. Lifelong complications include a frequent flux in the levels of blood sugar, numbing of the limbs, and excessive weight loss and gain. Chronic illnesses and conditions that derive from type 1 diabetes include hypoglycemia, which is low blood sugar, cardiovascular disease, diabetic retinopathy, and also neuropathy, which is the loss in the feel in the limbs. Okay. There is also a 3 to 4-fold increased chance of developing heart disease and a 33 decreased chance in developing kidney failure. There are also psychological and psychosocial factors that come with type 1 diabetes and hinder many young patients from having a normal childhood. These factors may include pre-psychological health conditions, family functioning, and social status. This study and the different factors that show, not different factors, but symptoms are, what am I doing? We're not starting over, I'm so sorry. Have an increased risk of depression, anxiety, and low self-esteem. Different symptoms are psychosocial disorders, of course, muscle tension, restlessness, difficulty concentrating, and frequent headaches. These psychosocial issues may derive from feeling different from friends and family inability to have a normal and the same diet as their classmates. On the contrary, youth facing type 1 diabetes do not have to feel different. They may perhaps help educate their peers and others on the effects of juvenile diabetes. There are also ways to reduce and prevent chances of diabetes. This includes for juvenile victims having a team of healthcare providers, including a physician, dietitian, and counselor to help with both behavioral and nutritional needs. Parents also should help monitor and inform their child of the medicines, especially insulin, that are necessary at the times they are supposed to be taken daily. Also, parents and friends can help them monitor their blood glucose levels and encourage them to be physically active. 60 minutes of physical activity a day helps maintain a healthy weight. Lastly, they can also manage a healthy nutritional diet. Cutting back on sweets, pasta, bread, and rice, and increasing overall weight, and consuming more vegetable, fruits, and dairy products helps to maintain a healthier diet. I said that already. Lord have mercy. Overall, juvenile diabetes and other forms of diabetes take a toll on many lives every year. Every year, over 13,000 youth are diagnosed with type 1 diabetes, and making it the third highest chronic condition in youth under the age of 16. These requirements help diabetics to better manage their blood glucose levels and weight. In addition to the medical features of diabetes, many experience emotional issues, including anxiety and depression. To help lower the number of diabetes cases, we must educate our youth and peers on this chronic illness and adapt a healthier nutritional diet in our society. Thank you.